Hello, my name is Javier, and I will be discussing some information on skinfold measurements. The purpose of performing skinfold measurements is to determine body composition. Body composition identifies low or high body fat levels which are associated with increased health risks. Skinfold measurements directly identify the amount of subcutaneous fat, which is fat located directly below the skin and is approximately 1/3 of the total body fat. This technique is subject to discrepancy due to sex, age, ethnicity, and improper technique or poorly calibrated equipment. The data collected from skinfold measurements is input into various regression equations which will help determine your body composition. And now Jose will be discussing the methodology when taking skinfold measurements.
When taking all skinfold measurements, it is important to remember that all measurements should be taken on the right side of the subject's body. Prior to taking measurements, all 7 sites should be marked and identified: chest or pectoral, abdominal, suprailiac, thigh, mid-axillary, triceps, and subscapular. A minimum of 2 measurements should be taken at each site. If duplicate measurements are not within 1 or 2 millimeters apart, that site must be retested. The skinfold measurements should be taken in a rotational order to allow time for the skinfold to regain normal texture and thickness. Jessica will now explain how to use and place calipers, as well as give a proper demonstration and description of 3 of the 7 sites, followed by Joshua.
The caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold. It should be halfway between the crest and the base of the fold as well. While reading the caliper, the pinch of the skin should be maintained and only held for 1 to 2 seconds. The suprascapular skin fold side should be a diagonal fold or 45-degree angle measured 1 to 2 centimeters below the inferior angle of the scapula. The suprailiac is also a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line, which is immediately superior to the iliac crest. The thigh is a vertical fold on the anterior midline of the thigh, which is midway between the proximal border of the patella and the hip.
When taking the skin fold on the abdomen, you will take a vertical fold 2 centimeters to the right side of the umbilicus, otherwise known as the belly button. On the triceps, you will also take a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes, with the arm held freely to the side of the body. For the chest, you will take a diagonal fold, 1/2 the distance between the anterior axillary line of the nipple, or 1/3 of the distance between the anterior axillary line and the nipple for women. For the mid-axillary, you will take a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. An alternative method is a horizontal fold taken at the level of the xiphoid or sternal border in the mid-axillary line. Cassie will now explain how to calculate body density and body fat percentage.
Once you have obtained all the necessary skinfold measurements, you can use various regression equations to determine body density and percent body fat. The equation we will be using to determine body density is different for women and men because of the difference in body fat each tend to have. We will be measuring body density using the 7-site formula for both men and women. For women, the formula is body density equals 1.097 minus 0.000466971 times the sum of the 7 skin folds plus 0.0000056 times the sum of the 7 skin folds squared minus 0.000012828 times age. For males, the equation is body density equals 1.112 minus 0.0004349 times the sum of the 7 skin folds plus 0.0000055 times the sum of the 7 skin folds squared minus 0.0002826 times the age. Once the body density is calculated using the body density equations, The level of percent body fat can be determined using the Siri equation, which is percent body fat equals 495 divided by body density minus 450, and the Brozic equation, which is percent body fat equals 457 divided by body density minus 414.2, which are the same for men and women.